So does stacking treatments together, like a shockwave device and a laser device, really deliver a better treatment than one alone? That's what I'm going to talk about today. First, I'm going to give you the short take on these. I've done some longer form pieces on what is a shockwave unit, what is a laser, and what is the right type of laser to use, but I'm going to recap these very briefly. If we talk about shockwave, which is this device here, we're talking about a concept called mechanotransduction. It sounds super complicated, but all we're doing is transmitting a mechanical energy that produces a wave of energy, and we can project that through tissue. So in this device, there's a projectile that through air is projected at the end of this tip, and that tip on top of the tissue is going to transmit that force into the tissue. And it's doing that in a very high amplitude, very short phase, and you're getting a lot of shocks in a short amount of time. So we call it shock because it's stimulating a shocking kind of response to the tissue. It feels somewhat shocking for those of you who haven't had it, because it's like getting on a trigger point during a massage, and people sit on that and work on that tissue, and man, you need it, but it's kind of like hurt so good kind of feeling. Because there is a mechanical irritant effect to how this works. And we know when we look at how it works, that mechanical stimulation of the tissue can be helpful for a number of different properties. One, we know it can induce a blood flow response in the tissue. Okay, so as we're stimulating that tissue, we can stimulate blood flow to the tissue. We can actually stimulate the development of new blood vessels or capillaries into that tissue. We can induce through the nerve response some analgesia. It's like when we get a massage and we feel really good after that, it's because we've kind of worked that tissue, we're releasing some growth factors, endorphins and enkephalins, and the body feels better afterwards. The other cool properties of this is mechanically it can help break down tight bands of tissue or scar tissue or even calcifications in the tissue. So very stubborn tendinopathies like calcific tendinopathies, say you have a calcium deposit up here in your rotator cuff tendon, or we can get these little calcium deposits that are left behind when we tear tendon structure, say at an elbow tendon here on the elbow. And if you have those calcifications, they can be quite painful. And so we can get on top of those calcifications and, you know, with the right amount of energy here, so it's not an uncomfortable stimulus to the patient, potentially break down some of those calcifications. So that's what the literature shows on these type of devices, that when you have some of those stubborn, slow to heal injuries, we can apply this mechanical energy into the tissue that stimulates a biological response by which we can heal tissue. So again, if we're breaking down calcifications or scar tissue, we're getting more flexibility back into that tissue. If we get more blood flow into the tissue, we can stimulate healing. And by inducing this action, mechanical action over the top of, say, a tendon or a ligament, we can stimulate collagen production, which are the integral fibers, literally the microscopic threads that make up your tendon and ligament structure. So if we're stimulating more collagen, we can stimulate more healing of the tearing in those structures and induce that change we want, which is the structure getting stronger, not weaker. Compare that to something like a steroid shot where we just go to the place that hurts, pop a little cortisone in there. We know cortisone has a potent anti-inflammatory effect, but it is actually catabolic, and it's been shown to break the tendon down. So again, getting tendons injected with cortisone is something I don't do in my practice because we're weakening the tendon. The potential for rupture there is there because if the patient feels better, but this tissue isn't any stronger, hasn't really healed, they go out and work on that tissue or work out, do something repetitively, they can actually get a tendon rupture. And I've seen that in my practice, not by injections I've done, but injections done elsewhere. So everything I put together in my practice is designed to stimulate healing of the root cause of the injury. So Shockwave is a treatment that can be used to stimulate that root cause injury in the tissue, ligament, tendon structure, soft tissue, muscle. And to some degree, we can penetrate with this energy focally down into a joint. And there's different types of shockwave. This is a radial device. We call it radial versus a focal device. Focal devices, as it sounds like, is going to focus that energy deeper down into the tissue. Radial is going to spread out a little bit more. So again, think about radial techniques being great for soft tissue injuries, muscle injuries, ligament, tendon. We use that a lot in my practice. But again, if you get on a superficial joint that is exposed to the surface, say like a knee joint, elbow, something like that compared to, say, a deep hip injury. If we're really trying to penetrate, inches down into a hip joint, probably going to need a focal unit to get there. So this is where we start to kind of split out the types of devices, what type of shockwave, what is the technology inside of these devices that you have to have, because I always talk about those 3 T's: technology, the training of the individual using it. Like myself, or in my practice, I have rockstar athletic trainers who do these treatments for our patients. They know the anatomy, they know mechanically what we're doing here, and they're great at applying these treatments to help our patients. So you got to know the technology that exists inside of these machines and what you're getting from the person that you're getting it from, what is their training, and kind of what is the technique protocol we're using. So if we think about this as a setup tool, or to stimulate and induce somewhat of an irritant that stimulates the body in turn to respond, much like we get when we induce tissue with a PRP injection or stem cell injection, or even an old school prolotherapy injection. Those injection therapies are going to stimulate inflammation, which stimulates this chain reaction of events in the body to stimulate healing by proliferating tissue and then helping that tissue get stronger when we give it the time and space over 6 to 8 weeks. So this is kind of like a setup tool. Now, if we take a laser, a class 4 laser, like I have in my hand here, this is the strongest laser we can use, kind of in this medical application, and we sequence this right after this. Now it's kind of like the good cop, bad cop, or this would be the bad cop and this would be the good cop. That, you're kind of irritated by the shockwave a little bit during the few minutes you're getting the treatment, because they're very short duration treatments, which is great. And then you follow it with the laser. So now if I've induced this mechanism through a mechanical force into the tissue, this energy acoustic wave, sound wave into the tissue, now with the laser what I'm using is a light wave, or light and really particle is what a laser is, and we can penetrate deep into the tissue to stimulate good things to happen. And the good things that happen is, one, pain relief. So when we stimulate over nerves with a laser and some of this sensitized tissue, those nerve fibers, we can have a calming effect. So people in the context of a very brief couple of minute treatment have analgesia or pain relief from laser. What we're also inducing is blood flow. So now if we've stimulated more blood flow into the tissue, or angiogenesis, new capillary development in the tissue from shockwave, we're also inducing that with the laser, and think about it as opening up the channels. So now we can push more blood into the tissue that needs to heal, and through that we can deliver more oxygen to the tissue and more nutrients to the tissues, which is why I always talk about nutrient resupplying. What nutrients do we need to resupply this tissue that's trying to heal? And I've detailed other videos about base fundamental nutritional supplementation versus strategic supplementation for injuries like tendon and ligament and cartilage, using things like collagen or glucosamine sulfate. So if we can open up that supply chain, that delivery system to get more nutrients, more oxygen to the tissue, we can help things heal. So when we sequence these, what we see though is a huge synergistic benefit. When we look at the studies and look at the literature on these devices, if it's a good device, not some knockoff phony piece of equipment, but if it's a legit medical device used for this application, the results alone are very good using either shockwave or laser. But when we sequence those treatments, and we do in my office by doing shockwave followed by laser, we get the best of both worlds in a very short amount of time to stimulate the maximum response in the tissue. So this is something that in my practice we're using as a synergistic group treatment for these soft tissue injuries. Say somebody's done a lot of work on it themselves, worked with a good physical therapist, and they just plateaued this injury and they can't quite stimulate it to heal. These could be very good tools to use in that application alongside the physical therapy as an intervention to stimulate more healing. And for the needle phobic people in the audience, it doesn't require needles. They're both very comfortable devices. You should never be getting shockwave and be laying there in a puddle of tears and biting a hole in the table, because we've had patients tell us that. And this shouldn't be at the intensity, because we can control the energy and the intensity here, but you should never be that uncomfortable getting a shockwave treatment if done correctly. Laser, walk in the park. Everybody should have no difficulty getting a laser treatment. So again, back to grouping this all together. When we put these tools together, we're going to get the best of both worlds with the the biologic changes that we're stimulating from these tissues. And the goal is to get the injury better faster, accelerate that path towards recovery so you can get back to what you love doing faster. So that's kind of the 101 on how we take these technologies, put them together in my practice, and help people get better faster. So if you like the content, as always, hit the like button, subscribe if you want to see when we put out new content on the channel, and in the notes, as always, below the video, if we can help you anyway and you're semi-local, or if you're not even local here to my practice in Tucson, there's a little link there. You can fill out a few questions for us, and somebody on my team will get in touch with you to figure out, do we have the tools to help you get better faster and get back to what you love doing?